thank you for the informative information given by the three speakers. Please don't go back and check your spouse whether they are having sound mind or not. The next question is that being making of will, such as like living will, lasting power, eternity, is there any way that the person can revoke? That's the first question. What happened? This person is too sick to write in for revolt, or maybe unable to write. Sometimes, they are in a very critical conditions, but they are still having this called, when your explanation means sound mind, and they wanted to revolt. Can someone else help them to do it?
I think I'll take it first, and then maybe then they can, everybody else can add on. Now, I think one of the important things is, why do you not, just now when I asked how many of you actually have a will, less than 20% of you have a will. The whole problem is think that you're all Buddhists maybe. You all believe that everything will change. Nothing is permanent, right? Let me tell you, all your wills are also impermanent. Okay, you can change anytime you want. So if you have a will, you can just change it. If you have a last will, okay, you decided to give everything to, say, your son. Then in your son decided to do something that you don't want to give anything to him, and you decided to give everything to your cat. You can. So tomorrow go and change. And immediately change, immediately you can start. The same, if you have prepared an advanced medical directive that you do not want to use an artificial lung or artificial equipment when you die, or when you are already terminally ill. So suddenly you decide to change your mind. You can still change. All you need to do is get someone who is of a sound mind, either that or get a doctor who come to you and realize that you have a sound mind to decide and change. Immediately that can be changed. So the only thing permanent is change. And even the living will, you have decided to appoint a letter of attorney to a person, you can still change. So it's better to have a document to help you just in case, rather than to have a situation where you got into a situation and you want to prepare a document and you're no longer of a sound mind. I think that will be more disaster than you just change. So if you have as and when you're well, you can change your things, you can change your will. There are people who change their will at least 4 or 5 times in their life. But you must be very smart when you change the will. You must go through a proper legal system to change your will. Now, first of all, I don't encourage you to go and do your own will. Why? If you are not going to change your will, that's perfect. If you have one will that will last you for the rest of your life, that's fine. But if you prepare a will which is 6:30, which is not very good, and you decide to change it yourself, then the court can come back and look at 2 documents and say, which one is the one with sound mind? And that's very difficult to determine because it's not done properly. So if you want to change your will, that's where the problem starts. Because people ask me, oh, you're a lawyer. Of course, you ask everybody to go to a lawyer to get a will done. I would say that as long as you don't change, you can do your own will. But if you change, you have to get a lawyer involved. Because that will, the second will must replace the first will. Fair enough?
Thank you. Thank you. I think we shall go on to the next topic with regards to, a person who actually near dying. Right. I have these questions here. Terminally ill patients always face, very depressed when they in a stage of pain, when the disease process have made them suffered. They always want to have this mind that, I must well die. Die, I think, is the only way that to get out of this painful situation. However, sometimes when they get treatment and the pain gone. And they change their point of view again. They say, okay, I think I don't want to die now. I want to go on again. Based on religion perspective, is there any way that we can actually promote emotional relief to comfort that person while the objective is to help them to achieve lasting mental or spiritual peace? Hui Kai Fa Shi, can you enlighten us on this?
Just follow our Mr. Chan about his explanation of the sound mind. From my observation is the majority people, they live up to the situation that are without sound mind, because it live on and on and on until the multi-organ failure happen, and so on, many disease. So my suggestion is that don't let that happen. Don't live too long. But I don't mean that you have to, for example, someone would say, then do you mean I can commit suicide? No. I mean, just listen to the rhythm of your inner life, and you will know when the time is up. But unfortunately, the modern people in the modern world leave the natural world too far away. So gradually, we lost our innate ability to correspond to the natural rhythm of life. So you're better practice. For example, you practice meditation and other, not necessarily Buddhist, the meditation, the mindfulness, and to restore your innate ability to correspond to the natural reason of your life. And you will know beforehand when your time is up and well prepared. But if you can apply the meditation, or even more, the Buddhist understanding, and that will make you much able to cope with. And as I've just mentioned, preserve your energy, the physical energy and the spiritual energy, and also prepare for your future life. I think that's very important, because we don't just have one life, we have many lives, the future life. If you know if you have a direction, from your learning, so where you want to go, you have a direction, you have a goal, then you can well prepared for your future life. That's the most important thing, is that you have to preserve your physical and the mental life for your future. And you can, so your conscience will leave your physical body peacefully. So what you have, just ask, that kind of situation won't happen. So try your best not to make self fall into that dilemma. Once you are in that dilemma, it's very difficult to get out.
Thank you. Very enlightening thoughts that from Hui Kai Fa Shi. Now, a lot of us actually have religion belief, and sometimes we wanted to help, because we wanted to, based on what we understand from our religions, in a practical way to help the dying patients. Many times that we hear about this, like, as Buddhists, we will ask them to recite Buddha name over and over and over again. Hopefully that they can actually help the dying to focus and achieve a sense of internal peace. Hui Kai Fa Shi, I would like to consult you that exactly what is the significance of this kind of praying and this kind of chanting to help the dying. What exactly is the benefit that we will get? Hui Kai Fa Shi.
Well, many people are asking me, is that chanting or prayer is just a formality or not? Is really, really useful, really helpful, or is it only a ritual? My answer is that it's really helpful and useful, not just a ritual or formality. Of course, the series is very, very complicated. But I can use a modern concept to explain the chanting process. Don't neglect the importance of the ritual, but only ritual itself is not enough. The most essential part is that our mindset. So when we are chanting Buddha's name, and that will form a network, a connecting network between the one who practices chanting and the person we are caring for example, our family member, and most important is the Buddha. So the chanting, the practice of chanting will form a kind of like the platform, or we can use the modern term, the electromagnetic field. It's the network connecting the Buddha, Bodhisattva, the practitioner, and the one we are caring for. And that will make a resonant among the Buddha, the practitioner, and the patient, and will influence and help the patient, the dying, to correspond to the Buddha. And from our real experience, for the dying or just passed away family member, through the chanting, up to 8, even to 12 hours, you will see the patient or the deceased person, the face will change. The face will change. At first, the face may look badly, but gradually, the patient is just passing away patient, the face will be so peaceful and even smiling, just like sleeping. and you will see the difference. You will see the difference. So with or without the chanting, the result is very different. So you can observe by yourself in the future.
Thank you, Hui Kai Fa Shi, very enlightening. And we have much information about to help the dying. Now, we will focus on the caregiver. As a caregiver, from the hospital perspective, we see our patients, no doubt they are not our relative, but, we are quite close if you have nursed them for a period of time. Seeing them lying there motionless, gasping, struggling for the breath that they are breathing in, can be very traumatic. This also applied to those caregivers who are the immediate family. How can we help to reduce this grief of the family members or the caregiver so that, some of the patients, no doubt they are in unconscious stage, but I believe that they can feel. So how can we reduce the grief from the family members so that we can actually help the dying, person to depart peacefully, based on spiritual way or medically? I'm not sure whether in your research, have you done that, Mr. Chen?
Yeah, I think one of the things about caregiver is that there's a very common term called compassion fatigue. And compassion fatigue is a situation where we can describe people who have been giving so much compassion that one day they got so tired and they say, no, that's enough. And it happens in doctors and nurses when you continue to face dying patient. After a while, you get worn off and you get burnt out. The same with caregiver. Caregiver also get caregiver fatigue. I give an example. If the person is sick for 1 week, 1 month, 1 year, 3 years, 7 years, 17 years, how many people can tell you straight in their face that they will care for you for 17 years? So that happens by a lot of definition, because I have a lot of situation where I work in a hospice and some of the old folks home, and there are people who never visit them anymore. Their name has been removed from their family book. There's no children, there's no relative. I've recently visited, I help out in the Renci at Wangkok as well, and I've seen patients who have never got visitors at all. They've forgotten that this person even existed. So there are a lot of situations where it happens and it is real. So I think it goes back to what sort of value system that we come from, and what sort of value system that we believe in our own practice. And when the Buddhists say that I'm caring for all sentient beings, and they don't like the cockroach, they don't like the foreign worker, they don't like the maids, they don't like this, they don't like that, then what are you talking about? So I don't know. I have worked with a lot of people from different religions, and there are a lot of people who has compassion for a lot of people that they don't know. But the people that they know, they don't seem to have that type of level of compassion. So in my research, I found compassion fatigue a real problem. And one of the ways is we take a break. That means you take a break and get out of a situation, come to Fo Guang Shan, listen to some of our lectures, or come here to do some meditation. Or maybe just rejuvenate the energy that you lost in this fatigue. Perhaps Wei Kai Fa Si, you can tell us more about this.
There is a saying, a Chinese saying, there's no filial pious children for the chronic patient, 久病无孝子. That's from ancient time. It's a case. So we need something more profound, the energy. So we have to back to the life itself, not just the patient. So how to help the family to get out of that that's a dilemma or predicament. I think one thing we can do is that to talk to the patient. Talk to the patient. Not just take care of his or her disease, but also his mentality or his spiritual. So from my own experience, that sometimes the patient themselves are stuck, and they may have very strong attachment to the life. So they need some inspiration or some direction. So we have to compassionately talk to the patient to guide them to detach from the worldly, that we have to comfort them that your life is already fulfilled and your time is going to be fulfilled, and you have to look onward for your future. And your body already are worn out. Your body is no more in good condition. So you have to let it go. And there is a future life waiting for you. So you have to very patiently, compassionately, gently talk to the patient, even they are unconscious. And of course, we have to resort to the Buddha, to ask the Buddha Bodhisattva to help us, to help the patient, and to do this over and over and over again. So it may take several months or even to half a year or even 1 year, but it won't last to 17 years. So you have to believe that. You have to believe that. So we have to give a guidance to the patient and help, because they may be stuck in that situation, and they're also afraid of death. So we have to teach them, to give them direction and help to release the attachment, and then ask the Buddha and the Bodhisattva to help us. Just from my own experience, it may take 6 months even to a year, but it will work. It will work. The faith will help the patient get out of this the predicament or dilemma, the situation. So, give it a try.
We have here from the spiritual perspective as well as legal perspective. Dr. Ng, do you have anything to share with us how to help the caregiver as well as for the dying patients medically?
So, caregiver stress can have many causes. So we need to know what specifically are the things that's affecting this particular person in front of us. So similarly, a person who is dying has their own sets of stress. So we need to know what is the things that's bothering them. So for caregivers, we need to understand what they're going through, you know. And imagine you are taking care of your mother, while your brothers and sisters, because they're married and they don't have to take care of mother like you. And then because you have to take care of mother, you may not have a career. And as you're taking care of mother, you're worried about your own future. Do you have enough CPF in your bank? And then if you don't, what's going to happen to you? Will your brother and sisters, because you're taking care of a mother now, will they in the future support you in your old age? So this is a common problem. Usually it's the unmarried daughter who take care of the, you know. And then if you're a maid, say you're a maid, and then you have to, most of our maid, I don't know why, it tends to be a bit small sized. And then the older person, they could be big sized, okay? And they could be cube fat, and the doctor keep adding calories, so they could be very obese, you know. So it's very difficult to bring them, and some of the employers will want them to bathe every day in a shower. You cannot sponge in bed, so you have to transfer from the bed to the wheelchair to the toilet and shower. So that's back-breaking, right? And not just that, if as a caregiver you look at your mother, you may start to remember how your mother did not like you, you know. You may not have a good relationship with your mother, and so on and so forth. So there are many, many reasons. So for every person who is undergoing stress, as a care provider or somebody, either as a pastoral care counselor or a volunteer or a relative or a friend or a doctor or a nurse or a social worker, we need to be very humble. We cannot tell them that we know best because we really don't know how to take care of their mother and we never not live their lives. So we need to sort of listen actively. Why are they feeling this way? And let them talk it out. And sometimes by ventilating, this could be the resolution for their stress. Then of course practical help. For example, if they could be unwell because they have stress because the mother is groaning in pain, then as a doctor I must do something about the pain. And then if they're very stressed because they are not able to take a holiday and they're very tired, they're suffering from burnout, then perhaps as a caregiver, a service provider, we can arrange for respite, meaning letting the older person admit to a community hospital or a nursing home for a short stay of 10 days or 7 days, so the caregiver can have a break. Then at the same time, the service providers need to give them sufficient knowledge. Knowledge deficit is also a source of stress, like especially when nursing someone with dementia who is screaming and shouting, who is asking to sit up, and when he's sitting up, want to lie down, and lying down to sit up, want to go out, want to come in, you know, perpetually. So you need to give them skills and knowledge. How do you handle such situations? So a lot of education, a lot of skills imparting, a lot of listening, and then referring for practical help like respite care or counseling or even medications when necessary. So caregivers also sometimes invite them to a clinic, you do a physical examination, you screen for situations like back pain, high blood pressure, anxiety, depression and so on, and then you treat accordingly. And a doctor is not enough, you need a whole team of doctors, nurses, and then and perhaps other home help services, people who clean the house for you, people who help you bathe your mother twice a week. So there are all of these services available, which is you really need somebody in the know to help you navigate and broker for such services. So this relieve the caregiver stress. And our aim is not just relieve the stress, but to really inspire the caregiver to feel happy to have the chance to take care of their parents. And really happens, we've seen it. So the service providers or the counselor or the volunteer, you really must believe in the meaning of this work. And when you do that and do it with joy, you can actually impart the sense of joy to the caregivers. And they'll feel very grateful that they're able to take care of the mother no matter how long. And I've seen children taking care of their parents or grandparents or husband taking care of the wife for years and years and years. About the person who is dying, how to take care of the person, same, you know. If you do not know the past, don't pretend that you know. So we have to really find out the life history. So you cannot do it in the first time I see a patient, I can talk about so many things, right? So it has to be a committed relationship, building a trust, and then you commit to this patient, and then they always turn to you, and then through the years you start to know the person, and then you know where they come from, their life past history, and then when they're dying, and then you know what is the thing that's stressing them, and then you're able to listen actively and give the right advice. So caring for somebody is a long haul undertaking, but it is very meaningful. It offers us a lot of opportunity for growth. So that's how I would take care of somebody dying and their caregivers. Yeah.
Thank you. Indeed, it's really a fruitful talk today. We are indeed honored to hear from the panel of speakers on their valuable thoughts. Let us put our hands together and thank them again for the... I will now hand over to Raymond for some questioning and answer sessions. If you do have any questions, perhaps only 5 minutes, that you can actually bring out your questions.
If you have questions, we have mics with Brother Mei Chen and myself. Please raise your hand.
My pet cat just passed away after 12 years with me. It took me 4 months of crying because in one of my dreams, I thought that she was my previous life white horse. I was happy, but I was sad. Happy that she came back to me this life. Sad because she's still in the animal realm. And I was sad and I was devastated because I cried for 4 months, keep thinking she's back to the animal realm. And I pray and chant every day and wonder if one went into the animal realm, will he or she have a chance to come back to the human realm? And that worries me day and night.
So, can I just recap your questions? It means to say that, your question is that, how do you want to relieve your cat from the cycle of animal?
In Buddhism, there is the Liu Dao, right? And my question is, can someone know if I go into the animal realm, do I ever get a chance to get out of the animal realm and perhaps come back to be a human? And that is why I cry over my cat, whom I think was my white horse from one of my previous lives.
Okay. So,
and that's why I say I was happy she's back with me now and she's gone, and I worry if she's gone back to be a cat or a dog or a horse. Maybe Fasu would be able to enlighten me.
Oh, don't worry about that. I think, well, to be a horse or a cat is not a problem. It's not a problem. So, were it happy or not, I think that may be the real issue. To be a horse may not be too bad, right? It had its condition, Well, but you can recite the Buddha name and transfer the merit to your pet. It seems that you and your pet has a quite close connection from previous life until this life and maybe into future life. When the Buddha said the sixth destiny, the sixth Liu Dao, but from the Buddha or Bodhisattva's point of view, as the Diamond Sutra said, Jing Gang Jing, Diamond Sutra said, there's no distinction or discrimination about the person, people, 无人相, 无我相. It's no self, no self-attachment, no discrimination between you and other people, and there's no discrimination among the living being. Among the living beings, that I think you certainly treat your pet very nice, right? That you care about your cat, and even your previous life, the white horse. So you show much compassion to your pet. So from Diamond Sutra said, 无众生相, that means no discrimination among the living being. So don't worry. You have to change the energy of worry to the energy of caring. If you just worry, you waste your energy. But you transform that worrying energy into a caring energy. Just recite the Buddha name to your cat. And maybe next life is not a master and the pet, but maybe friend. Thank you.
Good evening, Venerable Hui Kai Fa Si and distinguished speakers. I have a question to ask. If a person of unsound mind, right, because if you want to take refuge in the tribal gem, first of all, you must have sound mind, 正念, right? So if a person of unsound mind, can the person take refuge in the tribal gem? Will a monk able to do that for the person? Because I have a sister who was in a nursing home for many years, all right? And every time I visit her, after I talk to her, I will ask her to chant the Buddha name. And she always able to chant one time, Amitofo. Okay, and after that she won't, subsequently when I ask her to do that, she will not say, she will only say one time. So I'm very concerned now is, I hope that of course she can 皈依, take refuge, because I don't know where she's going to go in future. So, is it possible for her to 皈依三宝, to be a Buddhist?
Sure. Or you can, I think you can ask one of our 指导法师, our venerable, to see your sister, and you can just introduce the Fa Si to your sister and guide her to take the three refuge. You don't have, you can introduce.
But what if she doesn't understand at all? She cannot understand.
Well, don't worry about that, because it's not. We can ask the Buddha or Bodhisattva to help her. even, as I just mentioned, even the patient is unconscious, but our sincerity can break through the barriers. Then you must have the faith. You must have the faith. Our sincerity and the faith will break through the barrier. It's not our ability, but the Buddha's light, the Buddha's energy to break through the barrier. So you just faithfully and gently, compassionately talk to your sister, to tell her that your physical condition is not good. So you should let it go and follow the Buddha's direction, follow the Buddha's light to the future.
Thank you very much.
Thank you very much, everyone.
Can I ask you another question? This is my friend asked me to, my colleague asked me to ask you. Okay, she has a dog who she asked a monk to help the dog to take refuge in the tribal gem. So 那他的狗皈依三宝，有一位法师去他家帮他的狗皈依三宝，然后那个法师跟他讲说，你的狗皈依三宝之后呢，很快会往生。他就很担心，因为他非常疼惜他这只狗，他就来问我，他说：“你是佛教徒哦，你跟我讲是不是真的？”他说：“你可以帮我问一下吗？”
我听不清楚，他是说他的朋友来问他，就是他的狗呢皈依了三宝，然后那个法师说，这狗皈依三宝之后很快就往生了，所以他很怕，真的往生吗？好像还没有，所以他很担心他会往生。
Don't worry about that. When he will be reborn in Pure Land, it's up to the dog itself. It has nothing to do with the refuge. No. Okay.
Thank you very much, everyone. I think we have come to the end of today's forum. Let's give another round of applause to our speaker. So please rise while our speaker and guests leave the hall. Thank you very much.